vital signs, blood pressure, pulse, respiration, temperature were all checked and were normal. And on exam, he showed some signs of injury to his scalp on the right side. And when he had swollen, tender foot and no other injuries. That's how I would express it.
Yeah.
And then I would say on exam, that's our word in English, on exam, alert, maybe not oriented. Knows his name, but not time or place. That's all. So I'd say patient's alert, but disoriented, oriented only to place, but person, but not time or place. No cranial nerve deficits, and no motor deficits. He is able to follow commands, and on CT, because of the accident and the Glasgow Coma scale being 13, not 15, 15 is normal, 13 is impaired, we did a CT scan. And every time I teach today with the medical students, if you have a head injury, make sure there's no neck injury. So I go down and touch the patient's neck, and I do an x-ray of the neck. And then I would report the findings of the CT scan. CT scan shows a left temporal hemorrhagic contusion with small subarachnoid hemorrhage and no midline shift. The neurosurgeon wants to know about the midline, the ventricles, if you want to know if the push to one side or not. That's very important to me as a neurosurgeon. That's how I express it. I would then say diagnosis. I would agree with the diagnosis of a contra-coup injury, and I would say that the plan will be medical management. Why would the CT scan be repeated? Anybody have an idea?
Chúng ta chụp 4 lần đúng không? Trong một tuần chúng ta chụp 4 lần đúng không? Tại sao phải chụp nhiều vậy? Ai có ý kiến gì không? Tại sao chụp nhiều vậy?
He knows the answer, because he's been spending the day with me. What do you think?
I think because after the collision, maybe we will have the recurrent hemorrhage, or maybe we will follow up the edema in the brain. Yes, and many complications.
Right. And if you didn't have a CT scan, how would you monitor this patient's neurologically for neurological exam? What would you look for? Anybody have an idea when you ask?
Bây giờ mình không có CT scan thì mình tính sao? Theo dõi cái gì vậy? Theo dõi cái gì? Dấu hiệu gì? Hoặc là mình chỉ chụp cái đầu tiên thôi, rồi sau đó mình không chụp nữa. Nhưng mà mình phải theo dõi suốt một tuần lễ. Theo dõi cái gì?
So try anything. It doesn't matter if it's the right answer or not. Just try. How would you report to me how the patient is doing day 1, 2, 3, 4, and 5?
I think we have to follow the Thurston track.
The what track?
Thurston track.
Oh, Cushing's triad. Very good. Watching for Cushing. You want to explain why? Can you explain why? What is the Cushing triad?
The Cushing triad, degrade the heart rate, degrade the respiratory rate.
Heart rate goes down, blood pressure goes up.
Yes, and the respiratory goes down.
Yeah, very good. And that is a sign the pressure is, because sometimes, like we just heard, day 2, 3, the swelling gets worse. Okay? So I would say, I would report this patient has been stable for the last week. After 1 week, the danger is mostly over. So that's how I would use a medical report in our language.
In this case, the patient is 67 years old, and I saw in the hospital sometime 2 months after he has
this man. Sometimes they don't.
Yeah.
If,
The people over 40 years old, maybe from the beginning, no plan, no vocal.
well, I'm 72, so don't,
No,
don't turn me up.
no, but I say.
But he's right, he's actually right. The older, anybody, I think it's over 40,
Yeah.
the recovery is much more difficult. So I'm out of luck. You're lucky. If you get in there, you're gonna get better. I may not. That's a good point, very good point.
Các em nhớ là sau 40 tuổi khi người ta chấn thương sọ não vô bệnh viện chụp phim tất cả là bình thường về nhà 2 tháng sau mới bắt đầu có máu tụ dưới mặt. Usually subdural hematomas.
Yes, then,
After 2 months, 3 months.
if they're not better quickly, then, right.
For the beginning, it's hospitalized normal, MST normal, and lab full. And 2 months after, there's a headache, and back to the hospital with MST. Found out that it's subdural hematoma.
Chronic subdural hematoma. We talked with the students today at the general hospital. We talked about some cases just like that.
I saw.
Yeah, right. Well, good, thank you. Does that give you an idea? Yeah.
I think we need to follow up about the line reaction of the pupil and classical
Oh, yes,
scale.
you want to follow the pupil
Yes.
on the exam?
Yeah.
You want to explain why?
Yeah, because it will relate to the motor nerve of the eye, and then whenever confusion, this makes something damage to the nerve of the some nerve which control the motor nerve eye, then it will create this sign.
Yeah, to explain a little, I'll use a little different explanation. If the brain swells, it pushes the brain sideways, this contusion, and it stretches or puts pressure on the nerve that makes your pupil work, so it gets big. And that is a danger sign. The nurses, they're trained, they know that sign. They look for it on the patient, right? Right. What's it called in French? En français.
EDH uses
Okay.
Like Korea.
So that's good. Watch for Cushing triad. Watch the pupil.
Nhớ là phải theo dõi cái đồng tử nó dạng. Đầu tiên chúng ta thấy cái hội chứng 2 tăng 1 giảm. Hiện nay sinh viên ta gọi là 2 tăng 1 giảm, không gọi cái sinh nữa. Thì chủ nghĩa anh hùng cá nhân là đáng ghét nên bỏ mấy cái tên đi. Có sinh cái thiên liêng mà có sinh đồng liêng. Yeah. With the young certain medical 3 years, medical certain we say that 2 symptoms increase and 1 symptom drop.
Okay.
Why? You have to remember Cushing. Who is Cushing?
Who's Cushing?
Here. Cushing of the kidney,
Yes.
Cushing of the pituitary gland,
Right.
and now another Cushing. Too many Cushing.
For that's Cushing syndrome.
Yeah.
And for neurosurgeons in America, Cushing is a god.
Yes.
We only do with Cushing syndrome. Very good.
Giờ em giờ nhớ ông ba ông có xuyên mệt không? Ông hậu chứng có xuyên của võ thường thọ. Thêm một ông bệnh có xuyên của ung tuyến yên. Giờ thêm 2 tăng 1 giảm có xuyên nữa chấn thương cho nào? Mệt. Many có xuyên. Exhausted.
Yes.
Yeah, young, so they need time to play. Yeah, so why I have to learn by how many things? They become old like this.
Bless you. Right. All these good doctors.
Yeah.
Good nurses. Okay.
So I taught them that we need to learn American way. That is, when we learn it, what for? That means we don't learn by heart for everything. If I have to learn it, for what? If I learn it for nothing, no, sorry. But in Vietnam now, young learn. Finish exam and you forget it.
Right.
So, why? Why we have to learn that? You don't need to learn that.
You have to learn your own way.
Yeah. Mỗi người có một cách học.
I can give you suggestions, anything you need to think about, but you're going to have to find your own way because it's different.
Mỗi người có một cách học. Được
But people are human beings, people are people worldwide, so we have dilated pupil just like Vietnam, we have contusion just like Vietnam.
yeah. You just see, 1 week more time of anesthesia, but it costs too much.
It costs way too much.
Okay.
Yeah. In America, in America, medicine is twice as expensive for us compared to France. And our health outcomes are no better than they are in France. So in America, we are guilty of wasting a lot because we do lots and lots and lots of tests.
Yeah.
Now, if you learn to examine the patient, talk to the patient, you can many times avoid doing a test. They would not necessarily have to do a CT scan every week. If you watch for the Cushing response, you watch the pupil, and you talk to the patient, and the patient talks normal, you don't need to do the scan. Save a lot of money.
Yeah. Rõ ràng chúng ta chụp 4 CT quá phí. Chúng ta chụp một cái đầu, một cái cuối, còn cái giữa chúng ta theo dõi sát. Mà chỉ hay tăng một giảm, đồng tử có giảm hay không? Hỏi bệnh nhân quay đầu qua, quay đầu lại. Ra cái hướng tan mình. Hỏi bệnh nhân đang ở đâu? Trả lời. Hay gọi kệ họ mình trả lời em chí. Nghe điện thoại là u não, nghe em chí.